Dr. William Moss, should people get a flu shot this season?
Absolutely, particularly with what we are dealing with the COVID-19 pandemic. Anything we can do to help limit problems with health and illness, I'm all in favor of.
As an emergency and internal medicine specialist, when we look at the flu season and some of the symptoms of the flu, they may mimic COVID-19. So what kind of chaos is that going to present for those of you who are diagnosing these things?
Well, first off, the predictions for COVID-19 have been so far off, I'm not sure what to expect, tell you the truth. I think there's a twofold possibility. First off, with all the protective things we're doing now with masks and hand washing, if we had done that for every single flu season over the past 20 years, we may not have even had to mention about having the flu. So we may knock the flu down by just virtue of our other procedures we're doing for COVID-19. However, both, like you said, are very common symptoms, and the discrimination between the two will be practically impossible. Fortunately, now we do have rapid testing for COVID, and we have rapid testing for flu. So we'll be able to discriminate between the two in the emergency room, but the best thing is to not get the flu in the first place.
And by getting a flu vaccine, that can help limit the symptoms, but it doesn't guarantee that you won't get the flu. Is that correct?
Right. A lot of the differences between the COVID vaccines coming out and the influenza vaccine is that there are multiple dozens and dozens of influenza viruses. The CDC basically determines which of the 3 or 4 they think will be most prevalent in our society, and they make the vaccine for those 3 or 4, and that's what we get each year. The COVID vaccine is specific for that particular one. So even though the flu vaccine sometimes misses, and there are some flu types of infections that come through that are not being vaccinated for, still we feel that the odds of getting a flu shot does save thousands and thousands of lives across the country every year.
So let's break it down. What are the risks of getting a flu shot?
Very minimal. Just simple tenderness, pain, of course, at the site, a little bit of a fever. You may feel achy for a couple of days as your immune system is kicking in to generate the antibodies for that particular flu, but very little other symptoms. And pretty much I've had a flu shot for the past, 30 years every fall, and I've really never been sick from it. Some people feel they do get sick from the flu shot, but that is impossible because it's not possible to get the flu from a flu shot.
So injection versus nasal, there are 2 different kinds.
Still, the injection is the best way. The nasal is still questionable how effective it is, but if that's available to you and that's the only way you'd like to get it, then that would be acceptable. Each year to year, I'm not sure if there's availability for that, but the flu vaccine will be available first part of September, starting, actually within about a month or so.
William Moss, thank you so much for joining us here on Coffee Near Me. I'm Barbara Deed. Keep the conversation going. Who would you like to sit down and have a cup of coffee with and a conversation? And I do have a copy here. I don't know that you do, but Dr. Moss, thank you for your time.
Okay.
Thank you.
You're welcome.